Good afternoon. Welcome to Evergreen Family Medicine. Today is another edition of Evergreen Talks. The second Thursday of every month is Evergreen Talks Thursday, a Facebook Live event right here where our physicians, providers, and specialists present topics that matter to you. And we will always post these videos and more information about the topics at hand at evergreenfamilymedicine.com. And as you see this play out basically on the platform that you're watching, you can leave comments in the chat if you need questions answered by Dr. Tim or some other provider at Evergreen Family Medicine. And today, Dr. Tim, it is a topic that is everywhere, it seems, right now, because we are in that open enrollment period of time with Medicare. And I know you have important information to share with the folks. So I'm going to step out and let you conduct the Evergreen Talks.
Thanks, Brian, and good afternoon to you also. Medicare is more complicated than a lot of folks realize until they reach that age. A lot of people assume it's this large blanket of insurance, which is pretty much the same for everybody. Nothing could be more untrue. There's a misunderstanding for many about what Medicare does and doesn't cover. Most seniors are not aware of the choices they have and the consequences of those choices on the care they might receive. You mentioned open enrollment. That occurs every year for people that have Medicare as insurance. It's always between October the 15th through December the 7th. Yet I find that a lot of people don't even know what that means. So in the next 30 minutes, I'm going to try to break all that down into maybe understandable bites, whether you're just going on Medicare or maybe have been on Medicare for years. So I'll go to the next slide, and this is kind of your scorecard, some just basic definitions. A lot of you probably already realize that, but I'm going to put it out there anyway. Part A of Medicare is hospital insurance. That provides coverage for inpatient care when you're at the hospital. Part B is medical insurance. That provides coverage for your outpatient care from doctors and other healthcare providers, specialists, physical therapy, and so forth. Part C is Medicare Advantage. Medicare Advantage is government insurance converted into commercial or private insurance that covers everything Medicare does and offers additional benefits. Part D is drug coverage. It helps cover the cost of prescription drugs. So, how much do these insurance plans cost? Well, let me start off with the good news. Part A, you remember that's hospital insurance, is zero. For most people, if you worked enough and paid into Social Security, it is zero. So that's a freebie. It's the last one you'll get here. Part B, the medical insurance, what it costs to you depends on your income. For most of my seniors, it's about $170 a month. That's a base amount in 2022. But in the next slide, if you're more affluent, I want to show you how much you might pay for Part B. And you'll see there it starts at $90,000 and less and goes on up. And by the time you're making $500,000 or above, you're paying about $600 a month. I give that as reflecting income because there's some other items that are going to reflect income also as I go forward in what you might pay under Medicare. So the next slide is Medicare Advantage. Now, remember that was Part C. That cost also varies according to the plan chosen, not according to your income. But you do have to pay Medicare Part B premiums. If you go back to you don't have to go back to the previous slide, but if you remember in the previous slide, it said about $170 a month for most people. If you're making $90,000 or less, you have to pay the Medicare Part B premiums to be eligible. But what you might be saving is the Medicare supplement cost. Some people call that the Medigap premium cost, and also the Part D cost. Because with a number of Medicare Advantage plans, there is zero premium, zero deductible, zero copay plans available. The Part D, that's the drug coverage. Again, you have to pay the monthly premiums based on your income. But once you do, then this provides the coverage for your drugs. And that monthly premiums for the Part D is also based on your income. So if you make more, you'll pay more for Part D. I know it's getting confusing already, and I've only been talking a few minutes, but let me talk then to, well, who needs Medicare supplement, or you'll also hear it referred to as Medigap insurance. Well, think of it this way. Medigap or supplements cover what Medicare covers but doesn't pay for. And this slide kind of shows that information. You see under Part A, you have a $1,600 deductible if you go into the hospital. For Part B, that's medical insurance, you have a $226 deductible. And after that, you're still responsible for 20% of the cost that Medicare allows. And then Part D, which is the drugs, most of those plans also have a deductible for the plan starts to pay, and then you usually have a copay for that. So this is why you would get a Medicare supplement or a Medigap, because this expense comes to you because it's not covered by Medicare. Okay, then in the next slide says, well, okay, maybe I do need a Medicare supplement plan. In fact, I'm sure I do. How many different supplement plans are they, and what exactly do they cover? Well, it doesn't get any less complex here. There are 10 different basic Medicare supplement insurance plans. Now, please understand, I'm talking about the type of plans, not the companies selling them, but the type of plan. And they label each one of these plans with a letter of the alphabet. And every one of these plans have a different combination of benefits. Some pay more or less, and of course they cost more or less depending on what they pay. So if you think about a company, you say, well, I go through AARP, or I go through Regions or United Health or whatever. Well, every one of those companies will sell all 10 categories of these Medicare supplement plans. You choose, and how much you pay depends on that choice. These plans will then help with the copay and the deductibles, the thing up above that I said Medicare covers, but they don't pay for. But they cover them to different degrees depending on the plan. However, essentially all of these plans, certainly most of these plans, do not cover things like vision, dental service, hearing aids, eyeglasses, nursing homes, home nursing service. And they don't because these services are not covered by standard Medicare. Again, Medicare supplement plans cover what Medicare covers but doesn't pay for. They don't cover or they don't pay for what Medicare doesn't cover. The next slide then says, well, how much or how many insurance companies sell these 10 different Medigap plans, and what do they cost? Well, the answer to the first question is hundreds of them. Hundreds of companies offer these 10 different plans, and they're all at different price ranges. Even between companies, they don't charge the same. And again, I'll remind you, you do have to continue to pay your Medicare Part B premiums in addition to whatever it costs for the additional supplemental insurance. And the supplemental or gap insurance do not cover drug costs, so you also have to pay for your Part D. Lastly, it's important, you probably knew this, but I'll say it. These Medigap insurances cover only one person. So if both you and your spouse want coverage, whatever that cost is, you need to multiply by 2 in order for both of you to have coverage. Now, again, the coverage will depend then on the plan that you've chosen. Say, for example, well, I remember I said there was going to be an alphabet letter to each type of plan. So you say, well, I chose plan F or I chose plan G, and that's a high deductible option. Well, what that means then is you will need to still pay the first $2,340 not paid by Medicare before the Medigap policy pays anything. The monthly fee for Medigap insurance varies. It varies. What you have to pay depend on the plan you've chosen. It varies often based on your age, gender, and other health factors, but it is not adjusted by income. So a standard range for Medigap insurance is, say, somewhere between $200 and $350 a month is a standard range. Overall, you should expect a cost of about $3,000 per year or more for each person that's covered. So I hope that you're starting to grasp maybe a little bit the complexity that I was speaking to when I say Medicare is more complex than I think it ought to be. So the next slide just asks simply, well, what's the advantage of a Medicare Advantage plan? Well, the first advantage is simplicity. Medicare Advantage bundles Part A, Part B, Part D into one package. And you aren't dealing with 10 different companies with 10 different insurance types. So there is some simplicity. And the Medicare Advantage plans do have different tiers. And of course, a higher tier costs more and it is also more rich in benefits. But it is much more simple to understand and comprehend. The second advantage is cost. With Medicare Advantage, you still have to pay your Medicare Part B premiums, but there are plans who then offer, and I said this before, a zero premium, zero deductible, zero copay plan. And what you've just eliminated is the entire expense. I mentioned around $3,000 per person for the Medigap insurance, plus whatever you save from the Part D coverage. This extra expense is eliminated. And the third advantage is coverage. I want to say something right now when I talk about coverage, and it's important to understand all Medicare Advantage programs or insurance products are not equal. They're not even close. And so Evergreen scrutinizes these very, very carefully, and we only contract with a few. We contract with a carefully chosen few who offer the best coverage and the best service for our patients. Now, the services covered by these Medicare Advantage policies, first of all, cover everything that Medicare covers, but they also provide services that Medicare doesn't cover, like a comprehensive annual physical exam, such as dental care, expanded vision, hearing aid coverage. And the Medicare Advantage plans that Evergreen accepts are listed on our websites. I'm often asked what's new in the Medicare Advantage market. And for that, I would say the newest entry in Douglas County is Pacific Source. I've looked at their plan. I've actually been involved with Pacific Source, giving them input into what patients really need and want. And they are offering an outstanding Medicare Advantage product. A lot of folks in the area are very familiar with Pacific Source. They have an excellent reputation. Many, if not most, of our local businesses use them. I know Evergreen does for our own company. They're a non-for-profit company run by people that live in the Northwest, and they're very competitive in cost and benefits. Perhaps they're most known for human services. One of the claims they make is that they'll answer your call with a human voice within 30 seconds of your phone call. But some of the particulars of their insurance product they're offering in Douglas County beginning this next year will be a 3-month supply of medication for the cost of 2 months. They offer hearing aid and also hearing exam coverage. They're providing $2,000 annually for dental coverage, great vision coverage, including for glasses. They even offer plans with $150 per quarter for over-the-counter expenses. What is specifically strong about Pacific Source in their Medicare Advantage plan is they have unlimited out-of-network benefits. There's no referrals are required to see a specialist, and it's very travel friendly. People that work with Evergreen are hearing more and more about a company called P3, and they really get confused as to what P3 is all about. And so I'm going to take just a few minutes to explain that. The relationship between P3 and Evergreen is a collaborative one. Before our annual comprehensive visits, the P3 team reviews all the patient records from every source, every specialist, every hospitalization, surgery, consultation, emergency room visit, diagnostic study, and they bring just important findings to our providers' attention to make sure we address those. They also correlate and collaborate with our intensive medical management services. And this is a service where our providers and staff sit with the P3 medical director and social worker, and we do this twice monthly. And we find the most vulnerable and complex patients and work to find solutions to cut through red tape so that we can take better care of those people. P3 brings in a pharmacist to our providers to help find the most affordable medication options. We know what we want the patient on. How can we work to find to make that most affordable? We have quality specialists at Evergreen. They have quality specialists at P3, and they work together to share data and identify people at high risk. You know, this individual, their heart failure is worsening, their diabetes is not doing well. We really need to focus intensive care on that person for a while to try to get that back in line. These same people comb the chart for preventative measures that haven't been completed. They haven't had their hepatitis C screen. They need a mammogram, whatever it is, so that we can at least offer that care. The patient may say, you know, I think I'll skip, but at least we've remembered to offer that to them. I like the fact that our contract with P3 not only allows a comprehensive physical exam every year, and that's something standard Medicare does not. It actually requires it. And what this does, everything that I've been speaking to aligns incentives between the insurance company, the provider, and the patient, so that the focus is on preventative care. It's on keeping the patient out of the hospital. This helps insurance by lowering costs, and it certainly helps the patient, and everybody wins. Well, where do you go to get unbiased, good information, personalized to my needs to make a decision about the complexities that I've spoken? Because patients out there, each of these patients are on different medications. They have different anticipated needs, and they want to make sure that the company and the coverage that they're working with best suits their situation. I can't say strong enough. You really should seek out an independent insurance agent to help you guide that. I say again and again, this is available at no charge. It costs the patient nothing for that. And on our website at Evergreen Family Medicine, we have a list of agents that we especially trust and recommend to you, beginning October the 11th and then continuing through December 6th. On Tuesday morning from 8 to 12, one of these agents will be at our Harvard location to talk with patients. You don't need an appointment, just come in. We'll have some coffee and snacks for you, and you can talk with these people to understand your options better. It's important to Evergreen that you make the best decision for your situation because we understand that affordability is essential to care. Offering the best care isn't helpful if the patient cannot afford it. So that's kind of the best I can do to make Medicare simple, explain how it works and the options that you have. I leave you with a rendering of our new Sutherland Clinic, which is going to be opening in April 2023. We're really excited about that. And Brian, I'm going to turn that back over to you to see if there's any questions.
Right. All right. Well, thank you, Dr. Powell. First of all, we've talked about this, you and I, a couple of different times in some videos that people might see. And I think the two biggest points I think that you make that are so important that really talk about Evergreen's culture and your desire and goes back to the mission of Evergreen is that all of this work aligns incentives between the insurance, the provider, and the patient, and the goal and the focus is keeping the patient well and out of the hospital because this lowers costs and everybody wins. And I just feel like that's worth repeating. It's also worth repeating that with all the confusion, the difficulty of understanding all of this, you're doing your level best to make sure people have access to good people who have unbiased information for them right there at the Evergreen campus on Harvard.
Yeah, thank you, Brian. That's so true. And even if this individual now is approaching the end years of their life, they have severe chronic illnesses, they're on a lot of medicines, we know their prognosis isn't good. It's still important how we plan those last months of their life. It can be a struggle and very uncomfortable with a lot of in and out of the hospital, or we can really work to maintain their dignity and their comfort. And even align incentives with their own values. And that requires a conversation. And then sometimes we need to get the insurance involved because sometimes some of the requirements there actually interfere with what is in everybody's best interest. And that's where P3 is able to set aside some of the things that are actually getting in our way.
Some questions for you. It seems like you favor Medicare Advantage plans. Why is this, and why doesn't everybody just choose that option?
Well, I do favor Medicare Advantage plans simply because I see how confused my seniors are about which plans should cover what service, and they all have different premiums and deductibles. My patients don't understand what their coverage is or should be. And because of that, oftentimes they're afraid to obtain service. They forego services or are afraid to get prescriptions filled for fear of what they might owe. And so Medicare Advantage plans simplify that by bringing Part A, B, and D under one umbrella. Most of the time they do that at cost savings. Most of the time they do that and still offer substantial extra benefits. And I love that the focus is on preventative care. So all that's exceptional. So yeah, what's not to like, I guess. Now, the reason they can do that, this may be unpopular to say, but the reason they can do that is that private insurance companies can operate so much more efficiently than the government. It's the same reason we have options in mail delivery. The government basically pays to these folks, this is what it would cost us to take care of this people. You take care of it, and you can keep some of the savings if you're able to do that. And they have a lot less bureaucracy. We're able to work through red tapes to break down barriers to really do what's in the patient's interest, which usually almost always saves cost.
Okay. Next one up is talk a little bit more about IMMS that you have started, Intensive Medical Management Services. What is this about?
Well, it's not necessarily a good thing to be on this list, Brian, but it is something that's become increasingly obvious to me. And after 40 years of practicing medicine, it's a small minority of patients, maybe 5% or less, that make up the majority of expenses. And believe me, they don't enjoy making up those majority of expenses, but they can rack up exceptional costs, repeated emergency room visits, imaging, hospitalization. And when you examine what it is that are creating these needs, oftentimes what you find at the core is a very fragile, vulnerable patient who needs extra supports. And oftentimes it's not the medical issues that are pushing this, but it's isolation. It can be mental health, addiction, financial issues, nutrition, elder neglect, disorganization in their living circumstances, or other we call it social determinants of health. And here's the deal. Everything I just mentioned, none of these changes during their hospitalization. So they come in and we stabilize whether it's their horrible kidney disease or COPD or heart disease or diabetes or circulation issues, and stabilize it a little bit and send it back home. And when they're discharged to the exact same circumstances that created much of the problem that brought them into the hospital. So when we bring their physician or their PCP, all of our chronic care nurses, our community health workers, our medical director, the P3 medical director, the P3 social workers. Now we're bringing in Umpqua Health social workers as well. And we ask ourselves, what is it that is really necessary to change what's happening? What do we have to do? We can't fix some of these things, but we can sure try to remove barriers when oftentimes they're being placed, sometimes by the patient, but sometimes by the insurance company in our own operations. How can we support the patient to a more stable place? And so we bend the rules. We walk alongside the patient. We look at the entire spectrum of support, whether it's family, church, community, what organizations are there out there. And all of this takes time, it costs money, but it saves the system a lot more than it costs. And frankly, just readmitting the patient for the same issues again and again sure isn't working.
Yeah. And that is the truth for sure. You probably know that more than I do, though. So let's get back to Medicare specifically. What Medicare Advantage plan does Evergreen accept?
The ones that we're accepting right now are the ones that are listed on our website: Atrio, Pacific Source, Regents, Moda, and HealthNet. But I will tell you, every year we evaluate those. We talk to these insurance companies to make sure they're offering our providers the same value. We have really engaged with Pacific Source in developing their insurance plan, and we were quite clear in what our patients need. And so when you see the extra dental benefits and the vision and hearing aids and so forth, I can see they listened. We also ask that each one of these really engage with us, with our quality programs, with our IMSS program, so we can work together to tear down those walls, to solve problems in real time.
Last one for you, Dr. Powell. This one's kind of wide open. What do you wish every Medicare patient understood?
Brian, I think, first of all, I would ask Medicare patients, please cooperate with us in the preventative care visits. Now, for those people in Medicare Advantage, we call those CAV, Comprehensive Annual Visits. And I really enjoy doing those because we look at every single diagnosis that the patient has. We talk about it. We talk about end-of-life decision making. We talk about the vaccinations that they might need, all the preventative health measures, fall risk, just a ton of things. We screen for depression, and we try to see, boy, this patient's really vulnerable. I think they're going to need some extra help from our chronic care nurses or so forth. I can see maybe their ability to remember and stuff is less, and I'm just concerned about their fragility. So we bring all that and make plans for the entire year. For those on standard Medicare, it's called an annual wellness visit. Standard Medicare doesn't cover an actual physical, but they do still allow an annual wellness visit to address all the preventative health measures, and that is very helpful. Secondly, the second thing, and I mentioned this before, but I can't mention it too many, the independent insurance agent consultations are very valuable, and they're free to the patient. There's absolutely no reason not to seek these out, because it's there that the decision making becomes very personalized to your circumstances, to your medication. And finally, this is the plea both to the patients and families of those patients. If we ask you to accept our chronic care nursing services, please allow that. It is covered by Medicare, but the patient does have to accept that. These are RNs, and they become your personal nurse. They become your resource. They become one phone call, and they can get to your provider, and they become your advocate for healthcare. And when we ask these, we do because we see a vulnerability of slipping health. A lot of times that insight may be lost to the patient who says, no, I'm fine. But we can say, well, they're not fine. And we're concerned about medication errors. We're concerned about injury or illness or neglect. And it is ironic, but it is true that the folks that need the help the most are often the ones who decline it when it's offered, and then they end up going to the emergency room again and again and again at 10,000 times the expense for help that really isn't help at all.
Well, Dr. Powell, thank you once again for information around Medicare and during this open enrollment time, what that all means. Open enrollment from October 15th through December 7th. Lots of information available at evergreenfamilymedicine.com. For more information, I think Dr. Powell, Evergreen is putting in more effort and more information out into the public this year than certainly the last few years. You and I have been working together, and so I know it's becoming just more and more important that people have access to good information. They trust the source of that information, and I know Evergreen fills that role for people and wants to for more people. So I know that people appreciate that. So thank you.
We have a lot of elderly in our community, Brian. It's a wonderful place to live. We have a lot of assisted living areas and a lot of services for the elderly. So it is important that the folks really look at their insurance options, because it makes a difference if they can't afford the medicine, and they could have afforded if they would have had a different plan, which wouldn't have cost them anymore. That's an access problem. And so we would love to avoid those.
Terrific. All right. Well, you can see this video and a lot of other information online for evergreenfamilymedicine.com. Evergreen Talks are posted on the social media channels that Evergreen has, including now Rumble as well. So please join us every second Thursday of the month at 4 o'clock for another Evergreen Talk. We'll be back again next month, where physicians and providers and specialists from Evergreen present topics that matter to you. Once again, evergreenfamilymedicine.com is our website. Dr. Powell, thank you very much for the time. Happy fall and happy Medicare enrollment season once again.
Thanks, Brian.